I love DPC because it gives me the opportunity to care for my patients in the way that I think works best for them, and also gives me the opportunity to care for myself in the way I think works best for me. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in the Sugar Land area. And this is my DPC story.
Welcome to the podcast, Dr. Ashaye.
Thank you. Thank you for having me. I'm so excited.
So we are recording this before the DPC Summit, but I think it's so helpful that we moved your recording from when it was previously supposed to be recorded to after the DPC Summit, which is when it's airing, because of what I'm going to be asking you about and what you've been an expert about in your community. And that absolutely comes to becoming a doctor. It touches on being a doctor, but not only being a doctor, but a doctor who's mindful of their own health as well as the health of their patients, just like you shared about in your opening statement. So with that, I want to start by reading a quote that's on your website. And I want to ask where this statement came from, because it's not every day that you read a statement like this on a physician's website. And it clearly points to the fact that you are an independent physician and not one that has a whole marketing team behind the corporation running your clinic. So would you mind reading the statement that I pulled out and highlighted for the audience?
Absolutely, sure. It says, with the current health system today, people are forced to get care from so many different places. So they may forget how nice it is to have their own personal doctor, one that knows them well and is there when needed.
Such a powerful statement and such a powerful movement that we are all a part of. And patients are really finding that over and over and over in communities all over the nation. Now, again, going back to how you as a doctor created this statement, I want to ask, what's the story behind that? Because we are very aware that if we don't have room in our fee-for-service clinic, the patient has to go to urgent care, the patient has to go to ER. But what was your life like where you were driven to write this statement in particular and using the statement to highlight how your practice is different than the normal fee-for-service clinic?
Yeah, so I worked in various types of clinics before I started my own practice. And one of the things that really frustrated me about that was I would see people come from different places or go to different places, even though I was their doctor. So, for example, I'll see a patient with a cold or, and maybe it wasn't just a cold, maybe it was sinusitis, and because they couldn't follow up with me, they went to an urgent care. And then they got an antibiotic that maybe interacted with something they were taking because they didn't get the full history. And then they come back maybe 3 months later and they tell me, oh, I was really sick, a month ago. And I'm thinking, why didn't you just contact me? Oh, I couldn't get in, And so because they're getting care from different places, that care is disjointed and it isn't good care. It's like very simple things become complicated just because they're seeing different people. And it plays out in so many different ways. It could be even seeing a specialist and didn't communicate all the medications they're taking. And so I think people underestimate how important it is to follow up with the same person. Even though it may be convenient to go to all these different places, in the end, it really doesn't benefit the patient because so many things are missed, errors are made, and it just oftentimes complicates things. So haven't seen that a lot. I just, that's where it came from.
It's ironic because I was talking to a dear friend who's a DPC doctor on the East Coast, and she was saying today that literally all day today, it was like every single patient that she saw was, oh, I saw this fill in the blank person who's not my normal primary care. And all day I have worked to fix the issues. And so I know there's people in the audience who are absolutely empathizing with the journey that you've been through already and the journey that our patients are put through every day when they have broken care. And I cannot agree with you more that, as primary care physicians, I'm sure you do this too. It's like you have to translate what the care plan was, and then you have to, it's almost like we have to be this gate checker to say like, whoa, no, we're not going to do that. Like, that's not even okay because of who you are as a person. Like, I totally agree with you when you're talking about that it can absolutely lead to bad outcomes. When it comes to also the time crunch that we're put under in fee-for-service, you miss nuances. Like if a person is not quick to think about an answer, or if a person is an introvert, or if a person doesn't speak the same language you do as their first language, like you might not understand that I work in a tile factory and the dust is really what led to coughing because blah, 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 so it's so important to have direct primary care continue to thrive. And I really, really love that, on your website, you're talking about people having their personal doctor. I love saying that DPC is concierge medicine for everyday American. You don't have to have, a 7-figure job to be able to have someone take good care of you, an excellent care of you. So when you talk about this experience of having seen patients have broken care, what was going on in your mind at that time in terms of, were you thinking about, gosh, like I actually would be interested in seeing how I could do it on my own? Because clearly you've done that, you've made that decision and you've become a successful business owner. But what was starting in your mind as you continued to see these patients with broken care?
Yeah. So I think I just felt like it could be much better for the patient. And I started to question why I went into medicine, honestly. Like I thought I went in to help, and I felt like I couldn't tell if I was really helping. So that was frustrating for me because the follow-up was not great, right? You have too many patients on your panel. It's really hard to keep track of who, you can't follow up effectively. So you're depending on them to get back to you to let you know what happened. And sometimes, you don't hear anything for a year. and that doesn't mean nothing happened. It's just you didn't hear anything. And so when I heard about DPC, I was like, oh my gosh, this makes so much sense. Like, this is exactly how we should care for people. This is how I want to be cared for, where they know me. It's not based on whether or not I have, health insurance or not, or whether I have a job at the moment or not. It's based on a relationship with my doctor that I choose, not an insurance company choosing that. So there were just so many things about that just resonated with me. And I was like, okay, within this model, I can actually, this is what I signed up for when I was becoming a doctor. This is what I thought I signed up for. So it was like, okay, yeah, there is a way to prevent people from delaying their care. There is a way to help people have good care long term, and a way to know that you're doing that. Because, maybe with the fee-for-service care system, it wasn't clear to me always whether people were getting better or not. Because if they lost their insurance, for example, and they're gone for, I can't see them, I don't know, so then that used to frustrate me a lot because I just never knew. There were too many